welcome back. I'm Mabel Jong. You're watching continuing coverage from the HCEG Summit here in Boston, Massachusetts. And in our chair right now, Ray Constantini, founder and CEO of Bright.md. Ray, welcome.
Thank you so much, Mabel.
Well, just a quick intro into what Bright.md is.
So Bright.md often gets lumped into the category of telehealth. In fact, we were selected recently by Forrester in their New Wave report on virtual care as the only leader in the virtual care space. But really, I think the reason why we were selected as that leader is because what we really are is a care automation company. Our focus is on using technology to be able to automate and streamline the care delivery process for patients and for providers. We've made it 15 to 20 times more efficient and 15 to 20 times less expensive for people to be able to get care and to deliver care. And that unique approach is really what's positioned us so well. It's that we've taken that care automation approach and applied it first to telehealth.
Okay, so give me an example of how a patient would engage with Bright.md and what makes the process faster.
Yeah, so we license our software to healthcare delivery systems. We're big believers that patients want convenient, high quality, affordable care from their trusted healthcare team at the delivery systems. And so we've taken that approach. We've built software that we license to those delivery systems, and then they provide it to their patients. So a patient would log in through their health system portal or from their website, and think about us as kind of like a virtual medical resident or a virtual physician assistant. And it starts by going into the EMR system and pulling out information about the patient, and then uses that information to have a conversational interview with that patient. We ask the patient questions and gather information about their specific symptoms for the provider. We combine that together with information, environmental and contextual information. Where are you at? What season is it? As well as that EMR information. And we package that up and we give it to the patient's trusted provider. That provider then spends less time because they haven't had to go and gather that information, and they haven't had to spend all the time in these electronic medical record systems documenting that information. And so they're able to deliver both more thorough care. They're also be able to deliver it much more quickly. Patients on average are getting care in about 6.5 minutes from the time that they finish their interview with Smart Exam, and they're doing that from home or sometimes even from the bus. So this isn't a video interview; it's a text-based interview.
Okay.
And then the providers are able to deliver that care to them.
How challenging was it to come up with the idea and advance it to where it is now?
I think healthcare is always a complicated place. I've been in healthcare for a long time, so coming up with the idea and advancing it are two different processes. Everybody likes a good light bulb story about where does the idea come from. I've found that most of the time the best ideas evolve slowly over time. And this is the concepts behind what we're doing with Bright.md and our telehealth platform, Smart Exam, really started from back before I was a physician as a patient, and when I was looking to be able to get care for myself and for my family. But it evolved over time through the challenges that I was seeing as a physician. The fact is, providers spend 70+% of their time doing pretty low-level administrative work. It takes 36 clicks to be able to order a flu shot. And that's an incredibly frustrating thing for providers when they know that there's not enough provider capacity out there to serve all of the needs of their patients. And so that combination of patient experience, provider experience, and then also experience as a healthcare executive at a large delivery system, it was really that combination that pushed me to really want to solve this problem and have the passion that you need to move it forward.
So having gone through this process yourself of innovating your idea, how confident are you that the healthcare space can support innovation in the future?
I think healthcare has to support it. We were just talking about this in the panel a little bit earlier. this is one of the first times I've spent a lot of time now in healthcare, and I think this is one of the first times where I've seen large traditional healthcare delivery systems really recognize that there is an external threat. It's multifaceted. It is all of the new entrants into healthcare, whether that's Walmart and Rite Aid or Teladoc or MD Live or Lemonade or 98.6. All of those are folks who are looking to be a digital delivery system. They're all competing with traditional delivery systems, and that handful that I mentioned is not even 5% of the folks that are out there looking to change the way that healthcare is being delivered. Mm-hmm. And if traditional healthcare delivery systems don't recognize that and don't take a different approach, they will end up getting disrupted. So in one way or the other, healthcare is going to change, and my hope is that we can be a part of helping it change in the most positive way possible.
So what would have made your journey easier in developing Bright.md, if the space is open now or should be open to innovation?
It's more open. Tongue-in-cheek, not being in healthcare would have made it easier. Healthcare is a tough place to innovate. I think healthcare, by its nature, we work with patients who are in need, and we, as an institution and as a space, we are very risk averse, and I think that comes from the nature of being in medicine, being physicians and being clinicians. And I think that does tend to slow things down. So I think while that has been a challenge and does continue to be one, I think it also, it's beginning to change. And I think that same awareness that healthcare delivery systems are now seeing. I was in a meeting with a very large healthcare delivery system and went into their boardroom. And the boardroom looks out, beautiful set of windows, looks out across a green space to a Sears, a mall across the green space. And the CEO came into the room, sat down, and looks out the window, and he says, every single day, this is him saying this to me, he says, every single day I come in and I have a meeting in this boardroom, and I look out across the green space to that Sears, and I see an empty parking lot. And I remind myself every day that will be us if we don't rethink the way that we deliver care. And when I hear senior leadership from existing traditional healthcare delivery systems making that leap, that's exciting for me. That feels worthy of optimism.
For sure, very encouraging, absolutely. This is your first time here at HCEG. Are you encouraged by what people are saying after your presentation? You just had one just a few minutes ago, and also some of the sessions that you may be attending later on today?
Yeah. The fact that people are engaging around these topics, asking questions, it's always worrisome when folks in the audience don't ask questions at an engaged panel, and that was not a problem here. I'd love to see folks excited, enthusiastic, participating, and looking for opportunities to drive change. So absolutely, definitely enthusiastic about it.
Do you see more collaborations, partnerships happening between health systems and health plans coming together? And we also saw a big deal happening with Aetna, of course, recently. You see more of that going on?
I do. I think that I haven't quite decided whether it is a driver or a byproduct of the innovation, but absolutely. I think that the edges that used to be much crisper, so as an example, the edges between delivery system and health plan or payer used to be much more crisp. Now they're much more blurred. The same thing between the Aetna CVS merger is another example. That's something that would have been two completely separate entities, completely separate business models. We're seeing those all over the place, and I think that that is also arguably a harbinger of positive change. I think that one of the challenges that consumers, patients experience with healthcare is that fragmentation. And so my hope is that as those edges become a little bit more blurry and there's a merging between those, the handoffs and the complexities that patients experience there will get better along with those changes.
What's next for Bright.md?
Goodness. Well, we're very, very excited to be not only the leading platform in the virtual care space, but to really be growing that experience. And I think for me, virtual care was the right place to start. But the truth is, care doesn't happen virtually. Some care can happen virtually, but in order to truly have that consumer-centric experience of care, we don't want to think about it being digital versus bricks and mortar. It's not clicks or bricks. It really has to be both. And so we are on a constant journey of trying to make that care continuum as seamless and frictionless and consumer-centric and delightful as possible for the patients at our healthcare delivery systems. And so that's what's next for us.
And may I ask, what kind of physician were you before?
Sure. It's one of those funny things. I don't think it ever really scrubs off. My daughter teases me. She says, "You're not." She's 15, so she likes to give her dad a hard time. But she tells me I'm not a real doctor anymore. But internal medicine trained physician.
Okay.
So.
And would you have perhaps been a better doctor, or would have wanted to continue practicing if a Bright.md had existed when you were a resident and younger version of your physician career?
It's an interesting question. I never thought about it that way, but yes. I think that's part of what drove me to do this was to make the experience better, first and foremost for patients. I think everyone is drawn to healthcare. The vast majority of people are drawn to healthcare because they want to make a difference in patients' lives, and I'm no exception to that. But I think one of the best ways that we can make the experience of care better for patients is by improving the tools that we give to our providers, because they are the sharp end of the spear in that care experience for patients. And by giving them better tools, it makes their lives better and makes patients' lives and patients' care experiences better. And yeah, that's been part of my intention, I think, from the very beginning. Yeah.
Okay, Dr. Constantini, thank you so much for your time.
Absolutely a pleasure,
Really
Mabel.
appreciate it.